The year is 2021, and I am just starting my junior year of nursing school. I am assigned to the critical care unit due to me taking the critical care course. We go to the intensive care unit at Conemaugh Memorial Hospital where I get my first COVID-19 patient. The patient is a 35-year-old female with a husband and 3 children ages 4, 7, and 8. As I'm reading over her case, I see that she is on a ventilator, which is a machine to expand your lungs when you do not have the respiratory drive to do so. It is an endotracheal tube that goes down your major airway, down to the base of your lungs, and ventilates your lung tissue. I saw that she was on the highest possible settings, the highest flow of oxygen, and the highest pressure one can go. I looked at her chest x-ray. Her lungs were fibrosed to the point where they were like hard rocks, unmovable, unexpanding. Her kidney function was the worst I had ever seen in any clinical case. Her kidneys were in the final stage of failure, and she was on continuous renal replacement. This is a more intense therapy of dialysis and is continuous. It basically functions as the kidney outside of your body because your kidneys can no longer function. I look at her electroencephalogram, which is a fancy word for a brain wave monitor. It shows minimal activity. As I gown on, I put my N95 respirator on, I have my face shield, I have my gown and my gloves, and as I just open the door, I hear her nurse in the room call out, "Code, code." In the intensive care unit, this is a word that means cardiac arrest. Her heart is no longer beating. She has no advance directive, meaning she has no end-of-life care plans. She doesn't have a do not resuscitate. She doesn't have allow natural death, none of this. But she does have a power of attorney, which is her husband. Now her 37-year-old husband must make a decision for his 35-year-old wife on whether he should continue treatment or stop. As we are doing chest compressions on the patient and giving her medications to hopefully restart her heart, no therapy is working. As we have this difficult phone call, the husband finally says, "Okay, you can stop." This was a very emotional moment for me because this was my first on-clinical death of a patient that was under my care. As I step out of the room, I look around, and there is nothing but COVID on this floor. Every single patient is diagnosed with COVID-19 and suffering greatly. As I turn to the door on my left, there is a son in the room saying goodbye to his father as his heart slowly dwindles and he is being weaned off the ventilator. I found out later that this was just after he lost his mother to COVID 3 days prior. In that one moment, so many lives had been impacted by 2 deaths. A family of a husband and 3 young children losing their mother, and a family where the patient themselves had lost their spouse, and now their son is faced with the death of both of his parents. During my junior year of nursing, I had so much exposure to COVID. I had an internship in the cardiothoracic intensive care unit in the summer at UPMC Altoona. I had my critical care clinical experience at Conemaugh Memorial Hospital, and I had my preceptorship in the medical intensive care unit at UPMC Altoona. So let's begin. What even is COVID? COVID is a virus that infects the lung parenchyma, which is a fancy medical term for your lower respiratory tract. These cells expand and contract as you breathe in and breathe out, pulling in all of the oxygen your body needs to survive and releasing all of the carbon dioxide that your body needs to get rid of. According to research published in the Journal of Clinical Immunology, the mild symptoms of COVID include fever, fatigue, muscle pains, cough, a sore throat, runny nose, sneezing, nausea and vomiting, abdominal pain, and diarrhea. For many people, this is all COVID is. It's kind of a mild flu. But for the very elderly, the very young, and for people with comorbidities, this disease can take foothold in your body and never let go. The moderate side of COVID, advancing from the mild symptoms, you can develop pneumonia from the lesions the virus caused in your chest. The virus will infect the lung parenchyma, causing them to fibrose and not expand and contract like they are supposed to anymore. This gives way to other infections, such as bacterial infections, leading to pneumonia. In the severe cases of COVID, the pneumonia will lead to hypoxemia, which is a result of so much lung damage, your lungs can no longer bring in the oxygen you need for your circulatory system and supply of your other cells. In the critical and final stages of COVID-19, many people suffer from acute respiratory distress syndrome, which means that, as I said before, your lungs just can't keep up with the demand of oxygen and they can't blow out carbon dioxide. With that, it puts a big toll on your cardiac system, causing your heart rate to shoot up, but this is only for a short time compensation, leading your body into shock. There's also different mechanisms of COVID pathology that we are not exactly sure of, but there have been cases of encephalopathy, myocardial injury, and heart failure, and these are all due to a coagulation dysfunction that COVID can cause in the body, causing random blood clots to show up. Obviously, this leads to heart attack, kidney injury, and then eventually multi-organ failure, because when one system fails, they all will eventually fail. In the intensive care unit, and you can see to the photo in my right, we have patients on the ventilators, on renal replacement therapy, which is, as I explained before, basically just a giant kidney that's outside your body, performing the functions that your normal kidney would do. All the equipment needed in a COVID room is obviously the protective equipment, such as the gown, the gloves, the N95 masks, the shield, and for the patient, you need the ventilator, you need the CRT machine, you need a constant heart rhythm monitoring, you need a catheter so that we can monitor your kidney function. And then, of course, I was talking about earlier, all the blood pressure medications that you need to keep your body sustaining a circulatory system and keeping your blood pressure up. So, with all of the horrible things COVID does, it's so easily spread. Obviously, we have seen it is an airborne virus, so it's a 6-foot spread. Anybody in 6 feet has a chance of catching this virus. It's spread through airborne, so that makes it incredibly virulent. According to the World Health Organization, as of May 3rd, 2022, there were 511,965 711 confirmed cases and 6,240,619 deaths. For those with severe cases, most of them will hardly make it out alive. With how much damage this does to the body, many of them will go into multi-organ system failure. They'll develop blood clots in their lungs, in their heart, and obviously your body cannot sustain that, so you will go into cardiac arrest. But for those with the severe cases who do survive, many of them will have long-term airway management, meaning a tracheostomy, which is a hole that goes through your neck, through your trachea, and you can be set up with a ventilator to breathe for you because of the lung damage. Many, as I mentioned before, the continuous renal replacement therapy, Many of them suffer from long-term kidney damage, so they will need to be on some type of dialysis the rest of their life. And with the encephalopathy I had mentioned earlier, there's a lot of brain damage in survivors. People who might have neuropathies, paresthesias. So obviously this takes a huge toll on patients themselves and the patient population. But also it takes a huge toll on the healthcare workers. According to the New England Journal of Medicine, during COVID, there had been a huge ventilator shortage because of the severity of the illness and the patients needing to be on ventilators to breathe and live. Every ventilator was taken up, and many places just simply couldn't admit patients anymore. Not only are the ventilators taking up, but the dialysis machines, the continuous renal replacement therapy machines are being taken up. This means that all of our equipment is on shortage for the patient, including those of healthcare workers. There has been a lack of personal protective equipment, such as the N95 masks that protect the healthcare worker from getting COVID. And these are just the physicalities of COVID. Many nurses have left the bedside due to post-traumatic stress disorder, anxiety, depression, and isolation. Now, COVID has been detrimental to many families, the healthcare profession themselves, and worldwide. But through this pandemic, we can learn how to better prepare for the next one, better equip our patients and our healthcare workers with the tools to fight the new disease that comes our way.